Today we're here to talk about PTSD and trauma and how it presents differently for clients that we work with. Gabby, you work with addiction, I work with children and adolescents, and Jane, you work with couples. So I thought we'd start with you, Gabby, and just talking about what PTSD and trauma looks like when you work with clients that come to see you.
So oftentimes I'll have clients who come in presenting with addiction, and it doesn't come out until much later what's really going on. So it's as if the addiction acts as the manifestation of the PTSD. It's covering up that old emotional wound, and it kind of gets out of hand and the addiction becomes the primary problem.
How does PTSD and trauma, how does that affect the people that are coming to see you? If it's not for that and it's for addiction, how does that present itself? What do you see?
I typically will see people who are using stimulants because they're not wanting to go to sleep at night. Or I can also see people who are heavily medicating to fall asleep because it's so difficult. And when they sleep, they're having these terrible nightmares and flashbacks of the traumatic event or traumatic events.
So sleep is a big part of it, just affecting how they function on a day-to-day basis. If they're not getting enough sleep, they can't work or even carry on.
And we all know when you don't get enough sleep, it feels terrible and it affects how we act in our everyday lives. So add that with past trauma and using, and it can create a huge issue for people and their families.
What kind of traumas have you worked with?
I've worked with veterans. I've worked with a lot of people who've experienced childhood abuse, sexual assault. So those are the primary issues that I've been seeing.
Yeah. And with 4th of July coming up, I think it's probably important that we talk about veterans because that's really an underserved population. I think I was reading in the LA Times how there's about, I think the statistic is 22 veterans a day commit suicide. And 83% of that accounts for men who are going untreated, aren't getting the help that they really desperately need.
Yeah, and compared to civilian women, military women are committing suicide at a much higher rate as well.
What do you think prevents military men and women from getting help?
I think there's still a stigma around mental health, which is really unfortunate because we all should be seeking out mental health. I mean, very, very important. I think in the military culture, it's totally different. It can be less private, so other people would know, potentially know if you were seeking out treatment. And that may affect your career in the military.
So a lot of fear attached to coming in and being open and honest about that and how it might affect your career in the military. Okay. Or how you're viewed by others.
Right.
Okay. So you said you worked with addiction as well. Is there any particular stimulants or any type of drugs that are commonly associated with trauma?
A lot of painkillers. They're wanting to numb their pain physically and emotionally. A lot of meth use typically, because that can keep you up for days. You're not having to go to sleep.
And I mean, what would you say to someone that's coming in for the first time? They're on the fence with whether or not they want to be in therapy because of the stigma that's attached to it. How would you explain how you would work with a client?
Well, I typically use EMDR, which stands for eye movement desensitization and reprocessing, as well as equine-assisted psychotherapy. So I would explain those methods, and I really like using those, especially for people who are on the fence, because there's not a lot of talking that's required, and it's still going to work. So we can get through all of that pain, and you're not having to spill your entire story if you're not comfortable doing that.
I've heard of EMDR before, but I don't think I've ever heard it described quite in depth before. Could you explain to me what that looks like? How would you explain it?
So when we experience something traumatic, our brain's filing it away somewhere different than, say, I'm going for a walk, it's just a normal day. So when that happens, the brain kind of splits off and remembers certain parts of the traumatic memory while kind of pushing the other parts into the unconscious or storing it in the body. And with EMDR, we're able to kind of refile all those memories and put it back together so it's not having that intense emotional charge.
So it's not taking away the memory, it's
Right.
reducing the intensity of it so that someone that's experienced a traumatic event, whether while serving or a childhood memory of abuse, they still carry the memory with them.
Right.
It's less intense, and they can file it in the back of their memory without it affecting their sleep.
Right.
Okay.
So it's helping to reduce those really terrible symptoms that they're experiencing.
You said bilateral stimulation. Like what would that look like in session?
So that could be eye movements, or we have little buzzers that alternate that you can hold in your hand. We have little earphones that alternate tones. And we can also do it on horseback. So that would look like two therapists doing the EMDR protocol, and one would be walking the client on horseback, because when we're on horseback, we have that natural bilateral movement. So while one therapist is focusing on the client and doing the EMDR protocol with them, the other person is focusing on the horse, because the horse can act as a biofeedback system for us as well. So a horse may speed up or slow down or pick up their feet more slowly, or some sort of shift will happen, and we may point that out to the client or just take a mental note, like something's being picked up here, what was going on for you during that time.
So just observing the interaction between the horse and the person that's riding it. What is the horse communicating to the person?
Right.
So that itself would be bilateral stimulation.
Right.
What about for someone who's never ridden on a horse before?
Well, we'll practice. We'll have them walk around, and we're walking the horse, so we keep it very contained and safe. So if they don't have the balance for the horse, we can do it in the arena with our horses, and they can put the buzzers in their pockets and wear the headphones and still get that bilateral stimulation. But they're also able to still use the horses as the biofeedback system, because they'll react to whatever's going on for the person as well.
I mean, it sounds like a very unique approach in that you're saying that it doesn't involve a lot of talking. It involves more experiencing, reprocessing memory, and the emotion that's attached to that memory,
Right.
which could be very intense and overwhelming, which I think is a lot of veterans or people that are suffering from PTSD and trauma might be struggling with.
Yeah, absolutely. And I love using EMDR because even after the session's over, the brain will continue to process it. So it'll continue to keep working afterwards, which is really nice.
How many sessions does that usually last, where you work with someone using that approach?
It depends on the client, but it typically can bring up those activated memories much quicker than just talk therapy.
So while someone's on the horse, they're getting stimulated bilaterally, they're able to bring up a memory while on horseback. And then what happens?
We have them hold the memory, we ask them what emotion it brings up, and what, if they're feeling anything in their body, because a lot of times our memories can be stored in our bodies. And once they're holding that and we get them activated, we have them walk around on the horse, or we walk them.
So raising awareness of what they're feeling while they're remembering, and also where they're feeling it, where they're storing it physically in their body, and then allowing them to do something with that memory, with that emotion, and with that physical feeling that they're holding in their body.
Yeah, so we'll scale it, we'll have them scale it on from 0 to 10, how disturbing it is, and we'll just track that throughout the session. But we've been seeing very quick results on the horseback.
So you're getting really good results using this approach with veterans, with people that have significant childhood traumas.